Ellison Preschool, a PECS intervention. Our team of professionals include Lauren Cheetah, Kim Cornman, Lauren Grunwald, Cheryl Hill, Erica Lawson, and Austin Muter. Ellison Preschool's principal contacted this behavior consultation group after teachers were reporting large numbers of tantrums from various students in the classroom. Most teachers reported behaviors occurred due to an inability to share and a lack of communication between peers. Our consultation team has put together a plan to assist the staff of Ellison Preschool and the students of Ellison Preschool. Our consultation group was able to pinpoint the possible function of behavior through interviewing staff and administration, collecting data about antecedents, consequences, frequency, and analyzing the data. We developed a hypothesis, which is that students admit the tantrum behaviors to gain access to their preferred items from peers. We want to teach these students to engage in appropriate behaviors that will give them access to their preferred items from peers. Since 20 students currently do not have a functional method of communication, we want to teach them to ask for and tell us things they want and need. 5 students in Ellison Preschool already use a picture exchange communication system, otherwise known as PECS. So we will be introducing this to the remainder of the student population with deficits in communication. Through the use of a textbook, students will be able to ask teachers, assistants, volunteers, therapists, and administration for the items they prefer during playtime and during other activities throughout the school day. Eventually, they will also be able to ask their peers, and we will teach their peers how to respond to PECS as well. This will help increase communication and sharing while decreasing tantrum behaviors. Our consultation group has extensively researched PECS and communicating with peers. Through research, we found that PECS was first introduced by Frost and Bondi in 1993. And since then, it has been implemented for individuals ranging in age and language ability and disability levels. The research on PECS has been conducted across 15 different countries and in more than 100 publications. In addition to our research on the founding of PECS, literature reviews revealed that of 377 individuals receiving PECS interventions, only one adult had difficulty mastering the procedure. And in that same review, 83% of the individuals were diagnosed with autism spectrum disorder, and the ages ranged from 20 months all the way up to 40 years. From peer-to-peer research, our consultation group found that because PECS is a communication exchange between two people, it does not always need to be exchanged between child and adult, or student and teacher. In Payton et al. 2012, they used PECS to increase the number of peer-directed NANs with a differential reinforcement of alternative behaviors, or DRA, and prompting for 2 children aged 7 and 9. Now that we have gone through extensive research on the success of communicating with PECS, we will discuss how to implement PECS. First, baseline data will be collected on the current amount of time students are engaging in tantrums. Next, we will conduct a preference assessment, which will assess what students' most preferred items are. Lastly, a PECS book with specific items that are identified from the preference assessment will be created for each individual student using PECS as a means to communicate. There are 6 phases of PECS, and now we are going to discuss how to implement the phases of PECS. Phase 1 of this intervention will begin with the students gathering in small groups where their preferred items are in sight but are unavailable to them. The students will then be prompted by the teacher or extra staff or assistants to ask for the preferred items using their textbook and text picture cards. This will first be done using hand-over-hand prompts of selecting the picture and handing it to the teacher. The prompts will slowly and systematically be faded to less intrusive prompts. Vocal prompts will be avoided altogether as they are difficult to fade. The teacher will immediately deliver the item the student requests upon delivering the text card to the teacher. The teacher will allow the student to play with the item while they assist other students. Now let's discuss how to implement those Phase 1 MAN sessions. We recommend conducting sessions twice daily for about 15 minutes each. One session will occur in the morning and one in the afternoon. Teachers will be trained on how to collect data based on the prompt level needed for each individual student to use their textbook. Teachers and other adults in the classroom will also help prompt students to use their textbook during playtime, math, art, music, and any other naturally occurring activity in the classroom that requires students to communicate their desires or needs. Other phases of text include Phase 2, which is expanding spontaneity. Phase 3 is picture discrimination. Phase 4 is sentence structure. Phase 5 is responding to what do you want? And Phase 6 is responsive and spontaneous commenting. These phases are covered more in depth in our written plan. To teach staff and support how to implement PECS, we have included a training video that models how to implement PECS. You will find a link to the video on the next slide. Please use this link to access the PECS training video. Now that we have discussed the research and strategies for implementation of PECS, we are going to move on and discuss how to implement this school-wide for Ellison Preschool. School-wide positive behavior support. A leadership team composed of the principal, BCBA, a speech therapist, 2 teachers, 2 classroom assistants, and parent volunteers will be a part of deciding this plan. Everyone will be involved with the plan. Each adult who works with the children in Ellison Preschool will receive training to provide consistency between classrooms and activities. It is important that we intervene now to give these students an effective way to communicate in their natural environment. Many who have worked in our classrooms at Ellison Preschool understand that it can be challenging when children are unable to communicate their basic wants and needs. PECS gives nonverbal children an opportunity to use pictures to tell adults and peers what they want, and they can contribute to the classroom culture through communication. You might be wondering why PECS was selected for Ellison Preschool. PECS is a great communication system for children who are nonverbal, because not only can they use it in the school environment, but they can also use it in the home and community without requiring any training at all to communicate ease. Children can deliver a picture, and most non-trained communicators will understand what the child is requesting. The training team and the leadership team has composed a plan for all members of Ellison Preschool, which involves one-to-one training for adults during the early stages and group training for the follow-up stages of PECS, which we discussed earlier. Let's discuss the training and payment source for this plan in our school-wide positive behavior support plan. Training will be conducted between teachers and students. They will work one-to-one, and students will learn that the only way they can access their highly preferred items is to communicate with PECS. After students learn how to do this one-on-one, They will be given opportunities to practice with other adults. Once they are fluent in communicating with adults, these skills will be transferred to communicating with their peers. As far as payment goes, the leadership team has received funds for Ellison Preschool from the AAC Institute. The average cost for a child for PECs is $60 per child. You might be asking yourself, what if this PECs intervention does not work for our student population? Well, after the initial training is provided and implementation has taken place, an additional training will be held to help answer any questions or address any challenges that have been occurring with PECs. And as shown through the research, PECs is a highly successful intervention tool. Now, let's talk about who will be using PECs. Well, all students who are currently nonverbal will use PECs. Teachers will be teaching the students how to use PECs. And this will help because it will increase the communication among students and among students to teachers. We hope with this PECs intervention that sharing and turn-taking will also be increased because of the increased communication. And lastly, students will be able to communicate their basic wants and needs through PECs. PECs has been proven to benefit children with intellectual disabilities and children who are nonverbal. And parents will also benefit because they will be able to also understand their children's wants and needs. Lastly, let's discuss final tips on how to be successful with this PECs intervention. Be patient with your students as they are learning a new way to communicate with people in their environment. Be sure to reinforce your students immediately when they use PECs to request items, so they can quickly make the connection between exchanging a card for something they want or desire. Next, remember to have more than one staff available to assist with the early teaching phases of PECs, such as in phase 1, there needs to be a person who is the prompter and a person who is the communicator. Lastly, help the students communicate across different environments by using PECs in multiple settings once mastery is achieved in the school environment. Thank you for taking the time to listen to our consultation group strategy about PECs intervention for Ellison Preschool. Please contact our consultation group if you have any additional questions or if we can assist you in any way. Provided here is a list of our references if you'd like to review our research further.